Asked me in England, a student in one of the colleges, about dyslexia. Well, first of all, pediatricians don't take care of it. You're really involved in the ruling out more than the treatment of it. But if you were to define dyslexia in like a one-word sentence, how would you define it first?
It means that you have a reading problem, but otherwise have normal learning and cognitive function. And your learning problem is substantial in reading, where it's in the bottom 3% of people for your age.
Well, a lot of people said they perceive things visually and interpret things differently than you and I. And we have to re-educate them so they can understand the same way we do. Is that correct or incorrect?
Well, it's sometimes correct. The dyslexia is caused by a specific learning problem that's in reading, but most dyslexic people, roughly 80%, have dyslexia secondary to a language problem.
Okay.
So they have a relative weakness in language, which ultimately manifests itself as difficulty in reading. I'm sorry.
The most common presentation, I would think, is the kid's in school and he's not reading, would be the most common reason that would come to, say, a doctor's attention?
That's correct, and you wouldn't know that they have dyslexia until they start reading, so you don't know it until first or third grade. But a lot of the children that are slow at reading may have had some delays in developing language as well.
But the concerns I have, first of all, no one can sit down and decide, I'm going to have a dyslexic child. So the first thing I tell parents, if you have a problem with a child, it's not your fault. You couldn't even make this happen. It's not your fault. Let's work it out together. What you're involved in is ruling out some of the other things. Like, for instance, it could be a seizure problem. It could be a developmental problem. It could be autism. You have to rule all the other diseases, including ADHD. Is that true?
Yes, you can have those in association. And if you look at most kids that are autistic spectrum, they, have language and reading problems.
So your involvement is to rule out other things, which we hope we can help with. And a dyslexic child many times is going to get through an education process that will help them go through ruling out hearing, visual, seizure disorders, things like that?
That's right. And there are different ways of training kids that have dyslexia, but that's an educational process. That's correct.
Have you ever been exposed to some of these new computer programs that they say that might help kids with dyslexia?
Yeah, I mean, some of them, and I don't know which one specifically you're talking about, but I don't know that there's any data that one educational intervention is better than another in dyslexia.
But the number one reason a referral by a pediatrician concerned about dyslexia is lack of reading, a lack of picking up colors and interpreting what other kids would interpret rather easily at, say, an age around 5, 6, or 7. Is that usually what's coming?
It's entirely related to reading. That's right. You can't tell before. So even 5 is young to pick it up. It's usually 6 to 8.
Well, the student that sent me the letter was implying that we would pick it up, and truthfully, I don't think a pediatrician would ever pick up dyslexia unless it was brought to the attention of the pediatrician, the kid's having problems in school or at home with numbers.
That's correct. Except there are risk factors. So the most common one is a family history of language problems or dyslexia. If a kid has delayed language, that's a risk factor. So there are risk factors, but there's no, you can't tell before.
If a kid was mixing numbers and colors, at what age would you be concerned? Because most kids in the beginning do mix up numbers and letters and things like that.
Yeah, people sort of make that mistake where they think that mixing up numbers and letters or reversing letters means dyslexia, and the answer is it does not. It's just that once you have if you have dyslexia, like by age 9 and you really have a hard time reading, those kids are more likely to reverse letters and mix up numbers than other kids. But it's normal before that, and if they read reasonably well otherwise, it doesn't mean anything.
And I just